Blood clots. Okay, DVT stands for deep venous thrombosis. In other words, a blood clot. And if you look in that upper left-hand corner there, the calf gets swollen. You might get some discoloration, some skin changes. Um, and without prevention or prophylaxis, 80%, and I would say it's probably even higher, of patients who get a knee replacement are going to get a blood clot. Now, with prophylaxis like aspirin or other blood thinners, it's still 3%, and that sounds low, and that is better than 80%, but 3% of a million is 30,000 people getting a blood clot. That's a lot of blood clots. 1.5% of these people will also get what we call a pulmonary embolism. So getting a blood clot in your calf is annoying and painful, but if it breaks off and goes to your lungs, that can kill you. And unfortunately, that's how a pulmonary embolism will present in 1/4 of the people who get it. 1/4 of those people who get a pulmonary embolism die. They just present with sudden death. There's no warning. Boom. So that's 3,750 people per year die suddenly because of a blood clot going to their lungs after a knee replacement.